Let's now start with the nerve action potential, for which you might get a question like the one shown on screen in your university examination. Uh, Nerve signals, they are transmitted by action potentials, which are rapid changes in the resting membrane potential. Each action potential begins with a sudden change from the normal resting negative membrane potential to a positive potential. The action potential ends with the equally rapidly back to the negative potential. Now, let's look at the stages or phases of the action potential, which are resting, depolarization, and repolarization stage. Uh, this is the resting membrane potential before the action potential begins. And in this resting stage, the membrane is said to be polarized. In depolarization stage, the membrane suddenly becomes permeable to positive ions, such as the sodium ions. Large number of positively charged sodium ions, they diffuse to the interior of the axon, or you can say the interior of the cell. The potential rises rapidly in the positive direction. The change in the voltage, it stimulates the opening of additional voltage gated sodium channels. Now here you can see this term overshoot. The membrane potential, it may overshoot beyond the zero level and to become somewhat positive, because as the additional sodium it rushes in, the membrane potential actually reverses its polarity so that the outside of the membrane is negative relative to the inside. Now this depolarization stage, it may also be labeled as a rising phase of action potential. How does the repolarization stage starts, which is also called a falling phase? You see, within a few 10,000ths of a second, the sodium channels begin to close and the potassium channels open. Diffusion of potassium ions to the exterior re-establishes the normal negative resting membrane potential. Here, I wouldn't miss an important concept of after hyperpolarization or undershoot. Since many more potassium channels have been opened than are required and not all close when the membrane potential returns to normal resting level, and that causes an undershoot. So this hyperpolarization persists until the membrane permeability to the potassium it returns to normal. Voltage gated channels have a vital role in action potential, so let's dive in their detail. Voltage gated channels are of two types: the voltage gated sodium channels and the voltage gated potassium channels. Now keep in mind that these voltage gated channels, they are in addition to the sodium potassium pump, and the potassium leak channels. Voltage gated sodium channel, it has two gates. One outside the channel, and this is called activation gate, while another inside the channel, and this is called inactivation gate. At the resting membrane potential of minus 90 millivolts, the activation gate is closed. So, what causes the activation of sodium channels? In that regard, a threshold stimulus causes the voltage to rise between minus 70 and minus 50 millivolts. And this causes a sudden conformational change in the activation gate and opens it. And this is called the activation of sodium channels. Now don't forget that the sodium channels, they have to be inactivated also, and this phenomenon is time controlled. This inactivation gate, it closes a few 10,000ths of a second after the activation gate opens. After the inactivation gate closes, sodium ions cannot get inside. So the membrane potential, it begins to recover back towards the resting membrane state. Keep in mind that this inactivation gate, it will not reopen until the membrane potential returns to, or it is near to the original resting membrane potential level. Let's now move on to voltage gated potassium channels. This channel has one gate only, which is present on the inside of the channel. At the resting membrane potential of minus 90 millivolts, the gate is closed. For the activation of voltage gated potassium channel, when the membrane potential, it rises from minus 90 millivolts towards zero, it causes the opening of gate and it allows increased potassium diffusion outward through the channel. The decrease in the sodium entry to the cell and the simultaneous increase in the potassium exit from the cell, it combines to speed up the repolarization process. So this is how the repolarization of the membrane is achieved. Let me give you the summary of the events causing action potential. During the resting state, before the action potential begins, the conductance for potassium ions is 50 to 100 times as great as the conductance for sodium ions. This is caused by much greater leakage of potassium ions than sodium ions through the leak channels. At the onset of the action potential, the sodium channels instantaneously become activated and they allow up to 5,000-fold increase in sodium conductance. Then the inactivation process closes the sodium channels within another fraction of a millisecond. Concomitantly, the onset of the action potential also causes potassium channels to begin opening more slowly a fraction of a millisecond after the sodium channels open. At the end of the action potential, the return of the membrane potential to the negative state causes the potassium channels to close, but only after an additional millisecond delay. What you should not forget is the role of sodium potassium pump regarding action potential. As you can guess from the dynamics of the action potential, transmission of each impulse along the nerve fiber, it reduces the concentration differences of sodium and potassium between the inside and outside of membrane. But this pump, the sodium potassium pump, re-establishes the sodium and potassium ionic gradients after the action potentials are completed. You may get a question about properties of action potential. So here is a list of them. Action potential is sudden in onset. It has a limited amplitude and short duration. Action potential then Action potential obeys all or none law. It is self-propagating and it has a refractory period. Anions also have some role during the action potential, and they include the anions of protein molecules, anions of organic phosphate compounds and sulfate compounds. As any deficit of positive ions inside the membrane leaves an excess of these impermeant negative anions, therefore, these impermeant negative ions are responsible for the negative charge inside the fiber. In some cells, calcium causes most of the action potential through voltage gated calcium channels. These voltage gated calcium channels are slightly permeable to sodium ions also, but their permeability to calcium is about 1000-fold greater than to the sodium under normal physiological conditions. They open in response to a stimulus that depolarizes the cell membrane, and calcium ions flow to the interior of the cell. So, in which phase of the action potential the calcium channels are vital? They contribute to the depolarizing phase on the action potential in some cells. An interesting fact is that the gating of calcium channels is slow, as I am, requiring 10 to 20 times as long for the activation as for the sodium channels. And for this reason, they are called slow channels. These calcium channels are numerous in both cardiac muscle and smooth muscle. In certain tissues, calcium channels assume main role because in some types of smooth muscle, the fast sodium channels they are not present. Therefore, the action potentials are caused by the activation of slow calcium channels. Let's see the effect of calcium imbalance on the action potential. When there is a deficit of calcium ions, the sodium channels are opened by a small increase of the membrane potential. Therefore, the nerve fiber it becomes highly excitable and sometimes discharging repetitively without stimulus. Remember I mentioned compound action potential also? Well, it is a university question. A compound action potential is a multi-peaked action potential which is recorded from a nerve trunk. What could be the reason for the appearance of compound action potential? You see, a nerve trunk is composed of many nerve fibers having variable diameter. And thicker nerve fibers, they have greater velocities of conduction. So the action potential of the fastest nerve fiber is recorded first. Using these facts, the electrophysiological classification of the nerve fibers, that is based upon compound action potential. And there are different methods to classify nerve fibers, as you can see here, that they can be classified according to structure or function, or their classification could be based on the areas of their distribution or their site of origin. Then the nerve fibers, they are also classified according to the neurotransmitter they are secreting. And finally, diameter and the conduction speed of the impulse is also a factor on which the classification of nerve fibers is based. But here is the most common classification of nerve fibers. There are three main types of nerve fibers: type A, type B, and type C. Type A nerve fibers are myelinated fibers, and this type is further divided into alpha, beta, gamma, and delta fibers. Type B fibers are also myelinated, whereas type C are unmyelinated fibers. Here you can see the most commonly used classification of nerve fibers in humans, along with the average diameter of these fibers and their conduction speed, which of course is directly proportional to the diameter. Plateau action potential. That is another kind of action potential. In this case, the excited membrane does not repolarize immediately after depolarization. The potential remains on a plateau near the peak of the spike potential for many milliseconds, and then repolarization begins. This type of action potential occurs in heart muscle fibers. The plateau lasts for as long as zero point 0.2 to zero point 0.3 seconds and causes contraction of heart muscle to last for the same long period. The cause of plateau is the slow calcium sodium channels, which allow increased calcium conductance into the fiber. A second factor that is responsible for the plateau is that the voltage gated potassium channels are slower than usual to open. Well, this topic of conduction of nerve impulse is another university question. And I'm going to show you the propagation or the conduction of nerve impulse, or you can say the conduction of action potential along unmyelinated and myelinated nerve fibers. In unmyelinated nerve fibers, an action potential elicited at any one point excites adjacent portions of the membrane, resulting in the propagation of the action potential along the membrane. This figure A shows a normal resting nerve fiber, while this figure B, it shows a nerve fiber that has been excited in its mid portion. So the mid portion, it suddenly develops increased permeability to sodium. Keep in mind that the arrows show a local circuit of current flow from the depolarized areas of the membrane to the adjacent resting membrane areas. Positive electrical charges are carried by the inward diffusing sodium ions through the depolarized membrane and then for several millimeters in both directions. These positive charges, they increase the voltage in the adjacent polarized areas for initiating an action potential. The sodium channels in these new areas, they immediately open as shown in this figure C and D, and the explosive action potential spreads. The sodium channels in these new areas, they 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 all of a sudden begin, and the newly depolarized areas, they produce more local circuits of current flow farther along the membrane, causing progressively more and more depolarization. And that is how the depolarization process, it travels along the entire length of the fiber. This transmission of the depolarization process along a nerve is called the conduction of nerve impulse. As far as the direction of propagation is studied, the action potential travels in all directions away from the stimulus, even along all the branches of a nerve fiber. Wondering how conduction can be different and unique in myelinated nerve fibers? In myelinated nerve fibers, the membrane of a Schwann cell first envelopes the axon, and then the Schwann cell rotates around the axon many times. The multiple layers of Schwann cell membrane contain the lipid substance sphingomyelin. Since myelin sheath is an insulator that decreases ion flow through the membrane, ions can flow with ease only through the areas which are called nodes of Renwier. That is why the action potentials, they occur only at the nodes, and the action potentials, they are conducted from node to node. What it means is that the electrical current, it flows from the extracellular fluid outside to the exoplasm inside the axon from one node to another node. The successive nodes are excited one after another, and the nerve impulse jumps along the fiber, and this is called saltatory conduction. Saltatory conduction has certain advantages which are listed here. As the depolarization process jumps along the axis of the nerve fiber, This mechanism increases the velocity of nerve transmission in myelinated fibers. Saltatory conduction conserves energy also for the axon because only the nodes depolarize, requiring little metabolism. Since the insulation by the myelin sheath causes little transfer of ions, therefore the repolarization can occur rapidly. Based on this knowledge, one can state that the velocity of action potential conduction varies from 0.25 meters per second to 100 meters per second. Also, the velocity increases with the fiber diameter in the myelinated fibers, while it increases with the square root of diameter in unmyelinated fibers. Well, the last topic of nerve physiology in Guyton, that is the inhibition of excitability. Two types of factors, they decrease the excitability: membrane stabilizers and local anesthetics. Membrane stabilizers, such as a high extracellular fluid calcium ion concentration, it decreases membrane permeability to sodium ions and reduces excitability. While the local anesthetics, they act directly on the activation gates of sodium channels, making it difficult for these gates to open, thereby reducing the membrane excitability. And the examples of these local anesthetics are procaine and tetracaine.